Sustainable minds, sustainable minds, sustainable minds with IPSF.
Hi everyone, today is the first day of our World Earth Day campaign. We've looked at some interesting new facts on how environmental health issues are so close to us, and they may have a great impact towards human health from our previous series of infographics. If you have the passion to advocate for this issue and educate the public about this, now is the time to start. Let's learn from Rayan Kassem, who is the West Asia Regional Director for Youth for Nature, in today's IPSF podcast on how we can involve ourselves in the environmental health sphere as youths. Hi, Rayan. Thank you so much for joining us today in the very first IPSF podcast. We really hope that today's podcast gives our members a better understanding of biodiversity, food consumption, and how this can relate to human health and the pharmacy world.
Hi, Era. Thanks a lot for having me.
So before we get started, can you give us a brief introduction about yourself, your work, and how you became interested in your field?
Sure. So I'm a Lebanese environmental scientist, and as you said, I'm the regional director for West Asia. And what we mainly do is we engage youth on nature-based solutions, indigenous rights to nature, and climate justice issues in West Asia and globally as well. But apart from that, I'm also in the UNEP MGCY steering committee along with you personally. I'm also the national coordinator for the Global Youth Biodiversity Network in Lebanon, which is focused on biodiversity protection in Lebanon. And I'm also a youth ambassador for Real Food Systems. And I'm also the regional youth focal point for the Middle East and North Africa in support to the United Nations Food Systems Summit in 2021. So it's mainly a lot of youth advocacy work regarding nature and policy and decision making.
Cool, thank you so much. So I guess something else that I wanted to ask as well is how did you get into becoming more interested in like the environment, maybe from like your study days and how you got involved?
Sure. Well, it's been quite a long time. I think around 6 years or 7 years since I started, and I was just interested in learning how nature works and what are the services that humans benefit from the environment. And I went to study environmental sciences here in Lebanon, and I specialized in some marine biodiversity research. And then I went to Denmark and to Austria to do my master's, focusing on climate change. And so now I'm at the part where I'm more focused on how diets affect the environment, and how can we solve the climate crisis, especially as youth.
Cool, thank you so much. So it seems like you've had quite a journey to get to where you are today. So I'm really glad that we're able to have you, especially as a young person as well, because most of our members in IPSF are pharmacy students and recent graduates. So I think a lot of them will be able to relate to a lot of your work. So I guess one of the first questions that I wanted to pose to you is regarding the COVID pandemic. So can you tell me how the COVID pandemic has impacted biodiversity in ecosystems? And also, how can young people mobilize to become advocates for biodiversity protection?
Sure. So the main reason why we have the pandemic and why we had pandemics previously and why we'll keep on having pandemics in the future is because humans keep on interfering with the natural ecosystems and forests, biomes, and especially with biodiversity and wildlife. And what does that mean? It means the more humans keep on destroying wildlife ecosystems, the more we'll be susceptible and prone to be introduced to new, bacteria, viruses, and whatever, such as corona. Now, so that's the main reason why we're having the pandemic. It's because, viruses are coming from wildlife, and we weren't previously exposed to these viruses before from wildlife. So how can young people mobilize to become advocates? What they can do is that They could advocate nature protection or nature-based solutions, as what we call it, is to protect nature in general and to separate human activities or anthropogenic activities from wildlife conservation areas or nature protected areas. And so how can they practically do that? They could join a lot of youth organizations worldwide, even not youth organizations if they're medical students or they're medical professionals who are not youth anymore. Um, uh, and by that, what we do is that we put pressure on decision makers, national decision makers and global decision makers to promote policies that protect nature and protect biodiversity. So by doing that, we protect biodiversity, but we also try to prevent further pandemics.
Cool. So I think that that's something that a lot of our members will be able to relate to, because in IPSF we do a lot of work where we try to advocate for issues that are related to us as pharmacists or pharmacy students. So I think that getting involved in these external organizations is a really good way for pharmacy students, and not even just pharmacy students, probably just like health students in general, to learn more about how our kind of paths interconnect. So when it comes to health and the environment, like how these can interconnect, and being involved in external organizations, I think, who do advocating work on these areas, I think is a really good way for people to get involved. One of the main ways that I've been able to get involved is through the UNEP MGCY, which is what you mentioned earlier. So that has been a really new step for me, especially in IPSF, because in the past we've not really done much work on the environment and kind of how human health is impacted because of our actions to the environment. So I think that that's been a really good way. And for those that might be listening today and they want to get involved, reaching out and seeing what organizations are available locally or nationally, all of them are all online now, so you can probably just search it on Google and like see which of these organizations are recruiting, and they're all volunteer work, so it's quite easy to get involved, and there's not a lot of commitment into it. So I think that, yeah, those are some really good ways to get involved. So
Just to add a note on
yeah.
that, sorry, for those who don't feel like they have enough knowledge on the environment or biodiversity or the climate crisis, and they're interested in joining these youth organizations, mobilizing for biodiversity protection or the climate crisis, there's a lot of capacity building trainings that these youth organizations do, which anybody can join, and they could learn, and they give a very basic understanding of what biodiversity is, what biodiversity protection means, like how is this affecting local indigenous communities. So and they're all free of charge, so people just have to follow along I think on social media with these youth organizations, and then just wait for the opportunity to join a capacity building training, and then slowly they could build that knowledge, and then they could become youth advocates themselves.
Yeah, that's a really good point, actually, because I think that a lot of our members will either have like very little knowledge when it comes to the environment, or no knowledge at all. So I think kind of directing them to like capacity building workshops is really useful, and that's kind of one of the main purposes of us having this podcast and this campaign this year in IPSF, because we want to educate our members more about how our actions are impacting the environment, but then also how that is directly impacting our human health as well. And as healthcare professionals, one of our main roles is to kind of work with patients to ensure that they get the best treatment, and that they are getting the best kind of health that is of it like possible. So, and a lot of that is to do with the environment as well, which I know you'll go on to a little bit later. So the next question that I have is, why is it important for young people, such as future healthcare professionals like our audience, to be involved in the environmental health sphere?
All right, awesome. First of all, sorry, electricity went out, but I'm still here with you. Lebanon issues. In general, the health of our environment is equal to the health of us as humans. If the environment isn't healthy, us humans won't be healthy. And humans need to understand that whatever anthropogenic activities that we're doing cannot be separated from nature. So our lives, our lifestyles, and our choices, and our economic activities and social activities cannot be seen as a separate, dilemma than nature. Nature is not this separate, far away space where we just go and we exploit nature for economic reasons, and then we're living in cities or whatever communities we're living in, and those two aren't interconnected. The climate is interconnected. Whatever emissions happen, for example, in China or Russia or the United States, affect communities in Mozambique, Lebanon, India, and Pakistan also. So we're all interconnected. The whole globe is interconnected, and whatever activities happen or whatever activities are destroying nature or exploiting resources somewhere will affect those communities right next to it or communities worldwide as well. So we could start off with talking about air pollution. And what we're mainly talking about is PM 2.5, particulate matters 2.5 and particulate matters 10. I don't know if the medical community has an idea about these, but these are small particulate matters that are made from dust and carbon that come from the environment. And they're mainly dust. And so they travel in the air. And when people inhale them, they get stuck in your lungs. And the smaller ones, the 2.5s, are the ones that cause lung issues and lung diseases. And so where do these come from? Mainly, they're due to fossil fuel emissions. So when we were burning fossil fuels, those emissions in the air, oh, we got the electricity back. Those fossil fuel emissions that are in the air, when they're inhaled by people, they cause, lung diseases and lung cancer and all of those lung issues and breathing issues and asthma and so on and so forth. But you also have mining activities, and you also have quarrying. So those three in general cause a lot of emissions in the air, pollutions in the air, and dust, particulate matters in the air that affect human health. One example is there's a small town here in Lebanon called Shika, and over there are a few cement factories that are directly quarrying the mountains right next to it. And that town has one of the highest lung cancer rates in Lebanon because of those emissions from the cement factories. So what medical students can do, they could join the fight to stop these factories from doing all of these emissions, to switch to cleaner emissions and safety for human health, because those emissions are directly affecting people's health, and then that has to go down to the medical community to help out with that. Number two, we also have water pollution. And here we're talking about a lot of medical waste that comes from hospitals, or general household waste, or restaurant waste, or factory waste that are just spilled in rivers and that go down to the sea. And if someone's swimming, that's not safe. If they accidentally swallow the water and then they're poisoned, or if they're in the river and things get poisoned there. One example I remember back in my bachelor's degree when I was doing that, our professor gave us an example in the UK. I think somewhere in London, there's a river where hospitals weren't treating their like their sewage water, and that caused a lot of, or not just hospital, but the entire city wasn't treating its wastewater, and that caused one type of fish species in the river to become all female, and that almost led to the extinction of that species. And that's because of all the estrogen hormones in the water due to women getting their periods. And so because that was not treated before spilling it to the river, the high estrogen levels in the water made the fish eggs turn all into females instead of males, and that almost got them extinct. I forgot the name of the river. I forgot the name of the river, but yeah. And we also have, as we said in the first question, protecting biodiversity means preventing further pandemics. And number four, we also have climate change. As medical students, they should also be caring about the climate, because climate change causes things like extreme heat waves, which sometimes cause death in some people. We have floods that also cause death to to people, and that's also a harm to human health. We also have wildfires and also the emissions that come from wildfires and the danger to human health. But you also have sort of further indirect effects that come from climate change, such as water security and food security and all of these things, and even soil health. And if we can grow our food and if we can get water, that also affects human health. So there's a lot of things. And finally, there's new research from some of my colleagues about microplastics. Now, I think there isn't one point in the ocean in the world which is not contaminated with microplastics. And swallowing in that water which has microplastics also causes a lot of harm to the human body. I'm not an expert, but I do know that there's a lot of health effects from that. So there's a lot of things that cause damages to human health from the environment. And this is why it's important for the medical community and any other community in the world to join the fight to protect nature and protect biodiversity.
Wow, thank you so much, Rayan. Actually, there was a lot of, you shared a lot of insights into different ways that it is connected with human health. Something that I wanted to ask actually, which might sound maybe because I'm coming from like a health background and I don't really know much about the environment, but when you say like microplastic, what do you mean? Like,
it means plastic, just plastic that is broken down into very, very, very small parts that you can't see.
Okay, so like really small plastic, basically.
Yeah.
Okay.
Just that.
So I think that you brought up quite a lot of interesting points, which I think our World Earth Day campaign is addressing. A lot of them are surrounding, healthcare wastage. So that was something that you mentioned, and that is mostly something. I mean, that as well as some of the other areas that you mentioned is directly kind of related to us as health students and healthcare professionals. And recently, actually, I was in a webinar which talked about sustainability, and there was a pharmacist on there that actually works in the NHS, and she's currently doing work in her hospital about how to make small changes in the way that the hospital operates. So for example, one of them, I mean, I don't remember the details, but one of them was about the gases that are used during surgery. So when patients are being put under anesthesia, and the gases that are used, some of them are really harmful to the environment. And so she's currently advocating in her hospital to get those gases switched to something that's a little less harmful to the environment, because they're causing a lot of damage in the air quality. And obviously once those gases are used, they are released back into the environment. So that's something that is really kind of directly related as healthcare professionals. One of the other ways that I wanted to mention as well is that a lot of us that may be working in either community or hospital work a lot with patients who, we're providing medication to them on a daily basis, but also we're taking in a lot of returned medication, a lot of medication that's expired and not suitable for them to take anymore. So a lot of pharmacies, hospital or communities have a lot of programs which encourage patients to bring back their old medications to the pharmacy so that it can be disposed of in the correct manner, and not by just either flushing it down the toilet or throwing it in like regular wastage, because a lot of that can then contaminate wastewaters, and also therefore it kind of an example that I want to mention is like with antimicrobials and antibiotics. So a lot of the times when these aren't disposed correctly, they'll get in contact with a lot of the wastewaters and the disposal that's in just like generally like in the environment. If it's not being disposed of correctly, it goes into like the wastewaters, and then animals and other kind of species will drink this water. I think, I'm not really sure actually, but they get contaminated by it somehow, and then animals obviously are consumed by humans, and therefore the like antibiotic usage and the kind of remains of that is being passed through the food chain, and that's one of the main ways in which we are getting levels of resistance in the environment. And so improper drug disposal is one of like the main ways that we're contributing negatively to the environment, and that's one of the ways that we can make a direct impact. So if we're as health students and healthcare professionals, if we're constantly advocating for our patients to bring their old medications back, anything that is not used, specifically, even inhalers. So a lot of inhalers contain fluorocarbons, which impact the environment. So if they are not being disposed of correctly and just being put in the normal like garbage, that can also contaminate a lot of the waste, etc. So I think that these are like practical ways in which us as health students can get involved in the environment sphere, and also obviously the examples that you mentioned as well. So
just to bring in here, actually, the concept of environmental justice. What I mean is, many countries in developed nations or the first world or Western countries might have those financial and technological resources to be able to treat those wastewater fluxes to rivers and stuff like that. But there's a lot of developing countries like here in Lebanon, for example, wastewater is almost 90% not treated and just thrown into the rivers and down into the sea. And so it's a global issue that we need to solve, because as we said, those substances and chemicals do move through the waters and through the airs to other countries and other parts of the world. So we need to solve it on a global level also, and not just a local or national level.
Yeah, definitely. I think it's really important to highlight that, obviously not all countries have the same facilities and the same resources to treat contaminated water. So yeah, I think it's a really valid point actually that there are some countries in the world where the wastewater is just not treated at all, and it just kind of mixes in with the rest of like the rivers, etc. So yeah, that's a really good point actually. So I think the next question that I wanted to ask was is kind of related to food consumption. So we've talked a lot about kind of biodiversity and a little bit about contamination of waters, etc. Another aspect of when it comes to kind of like the environmental sphere is food consumption. So I wanted to ask, how is food consumption related to environmental health, and how can we as pharmacy students and future healthcare professionals incorporate this into our daily work when dealing with patients?
All right. Just to let you know from the beginning, feel free to object anything or talk to me about anything that you feel I'm talking about that is a bit sensitive. In general, food choices affect human health, but also the environment. And by or following all the research that has been done on food choices, land use, and environmental footprints, and even human health effects of our choices, we found out that what's good for your health is also good for the environment. So whatever you choose to eat that's healthy and good for your body is also good for the environment. And what I'm trying to say here is that I know that you're starting to laugh, but it's mainly if we switch from animal-based proteins and animal-based fats to plant-based proteins and plant-based fats, then that is better for the environment and for human health. Now, I know some people in the medical community, have different views regarding food choices and human health. I'm not going to comment on that. I'm going to comment on the environmental part. So, eating more plant-based diets are better for the environment. They use less water, they cause less pollution, they emit less greenhouse gas emissions in the atmosphere, and they save up space more for nature protection and all of these things. So as medical students or the medical community, what they could do is, I know that people have different personalities, and so you can convince people by different methods. Some people aren't convinced to change their diets or to make their diets a bit more healthy by talking to them about the environment. Some people are more into animal rights. Some people are more into health, their own health. For me, for example, what made me eat healthier is my health and not the concern of the environment, although I am an environmental scientist. So people have different personalities. And what I'm saying here is that the medical community can work hand in hand with climate advocates to promote healthier diets in general, more plant or less animal foods, by talking to patients that they're seeing, and showing them that the causes of, or showing them that the causes of their disease might be linked to certain foods, and by switching to other foods, that not only saves their health, but also saves the environment. But yeah.
So yeah, I think what you say is like a valid point, and I think it obviously does come back to with evidence, etc. And I think it is important that we do kind of showcase the facts, which is that yeah, switching to a more plant-based diet is beneficial, and it is it does contribute positively to the environment, and it causes less harm. And I think that sometimes you know, when people hear other people talk about, you know, switching to a plant-based diet, it can be quite controversial. People get quite you know, they get quite touchy about such a subject, and it's expected, because actually food consumption is a really it sometimes can be quite a personal choice, and some people are able to make that choice and some people are not, and there may be lots of different factors which can contribute to that, whether that is, you know, dietary restrictions, it might be other factors which can you know, contribute to that. It might be that certain people have certain conditions where eating certain types of foods may trigger their conditions. It might cause a flare up, it may cause different, you know, exacerbations of different conditions. So I think it's really important to not only you know, take that advice and take that information with like a bit of a pinch of salt, ironically, because you know, you have to kind of just work at it on your personal level, and if it's suitable for yourself, then you can do it. Like personally, you know, I have tried to cut out a lot of dairy from my diet, mostly just because, you know, I mean, like you said, people have different personalities and people do things for certain reasons. I mean, the reason why I cut out a lot of dairy is not necessarily because I'm like I strongly believe that, you know, it's not it causes like a lot of damage to the environment, but mostly because it's just a personal choice. For me, I feel better when I eat less dairy. So, but as you can see, like that does cause, just because you're making that decision for not an environmental cause, it still causes like a positive impact. So I think it's important that people become more educated on, you know, how you can make those changes and those transitions, because like you said, it does have a positive impact. And I think one of the other things I wanted to talk about is if, for example, you're not able to make the changes to a more plant-based diet, be more conscious with the kind of foods that you eat. So be wary of where your items are coming from, you know, what kind of, how far are they being transported, you know, how are you supporting the food items that you're buying. Like if, for example, you're eating something that's come all the way from Brazil, like obviously that's not going to be the smartest choice that you can make, because of, you know, all the pollution and air miles that this food item has traveled to get to you. So if you're, like I said, if you're not able to make those decisions, I think making conscious decisions is one of the ways. I don't know what you think about that, Rayan, like thinking about when it comes to, you know, the choosing like where your items have come from, and like if you can't make that switch to plant-based, but just make better food choices.
Yeah, and so what do better food choices mean? Also, we could also talk about that. So there's also a cultural aspect that we didn't mention. Lots of great cultural food has a lot of meat products and dairy products in it. And so even sometimes, I'd say personally, when you try to veganize those meals, it doesn't really work. It doesn't really taste the same, and just people don't really enjoy it. So other things that we could talk about being, you know, sustainable food consumption is also eating locally and eating seasonally as well. And I always give that same example. Not everyone in the world needs to be able to eat avocados. Like, you know, we can all have access to the same food all the time, 365 days a year. So try to eat local, try to eat seasonal also, but also try to limit the amount of calories that you're eating. Also, you know, like there's a lot of other things in your diet that are like processed foods, especially processed sugars and stuff like that, that are also harmful for the environment, also for your health, but that's not my part to explain. That's for the medical community to explain. And so, yeah, like in general, what I'm trying to say is make better food choices that are a bit more focused on plant-based meals. So let's say out of 20 meals, if you could have, you know, 10 less heavy meat or heavy animal-based protein meals, that would go the distance as to what you're trying to do for your health, but also for the environment. So yeah.
Yeah, I think that's that's a really good way to think of it actually. Like, out of 20 meals, if you can have 10 that are, less meaty or, more healthy, then you can make all the impact. Something else that I kind of just wanted to mention that I just thought of is especially when it comes to kind of, I'm trying to like bring it back to kind of like healthcare professionals and make it be a bit more relatable. So with healthcare professionals, I think one of the ways that we can encourage our patients to make like better health choices is by connecting them with, like you said, more like practical solutions, which are, eat locally, eat seasonally. Like, I think those are really good pieces of advice to share with patients, because a lot of our roles on a daily basis is speaking with patients and communicating, what are the best food choices that you can make and how can this positively impact your health as well. So I think that's one of the practical ways. The other thing that I was thinking of actually is, sustainable production when it comes to like medications and pharmaceutical companies. So I know that this is kind of a little bit off topic actually, but I think that this is something that we can also start to become a bit more aware of, is when we're because a lot of pharmacists obviously work in the community or hospital, but some of us also work in industrial pharmacy as well, which is involved with like the research and development of drugs. So I think that if, for example, one of the ways that I think we could also make like a positive impact is if we became more educated on what is the process of the production of our medications and our treatments, like what is the process that they're going through, how can this be made more sustainable, how can our packaging be more sustainable, which kind of links into a little bit about the microplastics that you mentioned earlier. So I think that there's a lot of different areas in which we can get involved. So hopefully that this podcast has given that insight into all the different areas that pharmacy students and health students and healthcare professionals can get involved in the environmental sphere. So I've really learned a lot from you, Rayan, as well. So thank you so much for sharing your insights. Do you have any like last words that you want to share with our members?
Thank you for having me, first of all. This is so nice that the medical community is actually trying to join forces with the environmental community, because as we said, everything is related. A final pledge to the medical community is to, keep on learning about environmental health stuff, and whatever you need to reach out to learn more, there are enough resources and online guides and webinars that are happening by youth and also other organizations for free and free of charge, that you can attend and learn more about, your personal choices, but, processes that are affecting the environment from medical activities as well. So yeah, please do continue the education towards or researching towards what's affecting the environment and environmental health. And hopefully one day we'll have a bigger community, all of us hand in hand with the medical community, to fight for a better climate and human health as well.
Cool. Thank you so much, Rayan. And thank you so much, everyone, for joining us for the very first podcast series for World Earth Day. So I hope that this podcast has allowed you to become a little bit more informed about, the different issues that us as healthcare professionals can get involved in. And so look forward to the rest of our podcast, which will be released throughout the week. And also keep an eye out on our social media for the rest of our World Earth Day campaign. Thank you.
Sustainable minds, sustainable minds, sustainable minds with IPSF.